sociologists who will reflect on the keynote panel presentations and share some of their own experiences working in rural communities, both here in the Midwest and across the world. This Raising the Cloak of Invisibility for Vulnerable Populations panel this morning is most certainly going to set the tone for the conference today and for the rest of the week, because we know that it's really vital that we recognize and better understand the vulnerable populations that are working in our industry so that we can improve our outreach, we can improve our education, and improve the services so that we're meeting the needs of this very diverse workforce. So today I'm super excited that we actually have a space for this discussion and that we can enhance the visibility of some of these critical issues that are faced by these workers and that affect their well-being. So with that, thank you so much for joining us this morning. Now I would like to go ahead and introduce our very first panelist. Please remember, you can use the chat feature. You can send me questions. I will keep track of them. I will ask questions to the panelists at the end of all of the panel presentations. And we'll also offer an opportunity to open up the mics at the end of the session. So you can always ask your questions in the chat or the Q&A boxes here through Zoom, or you can hold those questions until the end, but I'll be keeping track of those for us. Okay, now with that, let me introduce our very first panelist. Knesha Rose Davison is a public health program director for the AgriSafe network. She obtained a Bachelor of Science degree in Biological Sciences in 2002 and a Master's in Public Health in 2006 from Northern Illinois University. In June 2016, she obtained a certificate in agricultural medicine, which focused on rural occupational health and environmental health and safety. Her program areas are opioid misuse, young workers, and women's health. Knesha is the staff lead for 3 programmatic areas, which include worker safety training, Invest in Your Health, and healthcare provided targeted opioid misuse prevention trainings. She's dedicated her career to health education and promotion to underserved and vulnerable communities. So please help me welcome Knesha.
Thank you, Dr. Ramos. Good morning, everyone. Can you hear me okay?
Yes, we hear you.
Good, and you can see my screen as well. Well, I am very excited. I spoke with Gail yesterday and she reminded me this is my second MRASH, but I'm not ready to count this until I can be there in person. So this is my second virtual appearance, but I'm so grateful to be invited to this keynote presentation on a very serious topic. I'm going to start my timer to make sure I stay timely because we have a lot to cover. And I want to be focusing this morning on the topic of women in agriculture. All right, so just to kind of start where our journey began at AgriSafe, I always like to look back because I was very excited again to be brought to the conference to really talk about this issue. But AgriSafe has been working in this space for several years. I want to say around 2014, 15, 16, kind of in that space is where we began. And we always like to kind of start new projects and new subpopulations or topics with the think tank, where we kind of do a virtual focus group and get feedback from across the spectrum of ag and safety professionals, producers, rural healthcare providers, just anyone kind of in this space that has something to provide in terms of feedback. So when we looked at this feedback that we received from participants, where we asked them what was their top public health issue facing farm women, we got a lot of information and it spanned the gamut, but you see that stress is the one that kind of rose to the top there. Access to insurance, exposures, or just, pesticide exposure, some of the physical risks that we always think about in the ag and safety space, but some other things that may not have kind of been at the forefront, thinking about things like prenatal care and rape and sexual intimidation and things like that for groups of people like migrant farm workers. So this is just kind of giving you an example of all of the gamut of topics that kind of come to mind when you think about public health and safety for women. And so we kind of took that feedback and then started looking at where could we make an impact and what kind of topics should we cover. So before we kind of get into all of that and some of the safety concerns, who are women in agriculture? We know that women have been a key figures in managing farms and working in agriculture. And this is kind of a list of all the various roles that we play. Some could be at the same time, literally. So secondary operators, we know that a number of spouses take on that role as secondary operator of a family operation. Mothers, they're on the ag board and advisory council members. Sustainable ag literacy advocates, farm manager, animal husbandry experts is one that really rises to the top. Entrepreneurs, of course, bookkeeping and record keeping has been a traditional role, but they're also the businesswomen of the farm, and they physically farm. They're physically out there doing that farming and ranching work, which is kind of one of the topics that we chose to really dig into. And then we just continued after we did that virtual think tank, we kind of continued in this space because as a result of the 2017 Census on Agriculture showed that there was about a 27% increase in women. So about 1.3 women have been listed as primary operators and producers of their farm. And so even though we've seen a decline overall in people who are working in ag, we've seen an increase in women. And we believe that was because of a change in some of the census questions, but also women recognizing their roles and not just saying, oh, this is, I work on a farm, my husband or my father, but they're being counted as well in those numbers in terms of being producers. So that was very significant. And we wanted to take advantage of that momentum. Here, we just continue that conversation where you look at farm decision-making and type of decision by sex of producer. So women being the orange, males being the lighter yellow, if you will. So we're seeing, I kind of focused on some areas around livestock management and then day-to-day operations. You see a very significant number of women, up to 78%, are managing those day-to-day operations. And again, contributing to some of that physical labor. This just continues to show producers by sex. As of 2017, about the average age is 57, but about, again, 1.2 million women are kind of working in this space. So it's something we definitely need to pay attention to. That's hard to look at that number, 1.2 million, and say, hey, this isn't a subpopulation of people that we focus on and should consider in terms of safety and health, outreach, and education. And then I would be remiss if I didn't mention migrant workers. We know a significant number of our migrant farm workers within the U.S. Fall into this category, and about 21% of that are women of childbearing age. And that really poses significant for a number of reasons. I will say that my soapbox is maternal and child health, so I always like to look at issues concerning here. But in terms of this space, this is very significant. And if I had more time, I would really go into some of the concerns around worker conditions for migrant farm workers, especially migrant farm worker women who have been just an invisible group, especially when you're looking at issues of sexual harassment in the workplace. It's very, very rampant for this population. And we really try to do education for ag employers, ag employees themselves, because again, just like other issues, this isn't a women's issue, it's a work safety issue, and everyone has a stake in keeping people safe in the workplace, from management all the way down to your co-workers or working cohort, if you will. So I definitely wanted to mention that. In terms of just, this is a kind of a survey that looked at female producers in the education of women farmers. They're more likely to be college educated. A higher percentage of women farm operators have an education over male operators, regardless of the age attended or completed college or not. It's just a larger number of women actually attend college, if you will. And then women farmers are more likely to be college educated on farms with a revenue of less than $250,000. And I think that's, in terms of just that trend, I think that just kind of follows a natural trend women being more, lots more women attend collegiate programs than men nationally. This kind of just speaks to some of the literature. Again, this is from a presentation that we've updated from, I believe, 2017, 2018, but it's still fairly difficult to find information around women's safety in agriculture in some of the literature. It's getting better, but it's still a deep dig and a hard find. Ann Carruth, who serves as a board member on AgriSafe, published an article that says women on farms are exposed to a multitude of biologic, chemical, physical, and mechanical agents while performing farm tasks. It is evident that women will be an increasing force in agriculture. So if she had a magic scope she saw into the future, we're starting to see those numbers in our statistics and even some of the products that are developed because women are taking a greater role in agriculture. And then agricultural medicine stated they describe similar risk areas for women in ag, with inclusion of livestock related to injuries, fatigue, risk of cancer, and depression. We're seeing those same conditions within the role of ag and how it could be isolating. We see some of those same conditions in women as we have previously saw in men. So on top of being a very dangerous industry with a number of risks that could be presented as a result of work, there is an inherent concern of health disparities for rural women. So on top of occupational risks, you just have your natural some kind of health disparities. So overall, there has been more, trying to make the screen smaller here, more concerns around poor health outcomes. We know access to care is an issue for urban women, less access to care than urban women, if you will, especially when it comes to specialty providers, especially when it comes to maternal child health and OBs availability, especially if it's high risk. There's a limited number of healthcare providers for women health in general. So you see a lot of family medicine or primary care kind of taking over that role because access is a huge issue in our rural communities. Higher rates of heart disease, including fatalities, cardiovascular disease among rural women has increased since 2009, and I believe continues to do so. And then less access to preventative screening options for breast and cervical cancer. So we know that it's just lots of different concerns. So on top of these things, why do those health disparities exist? Difficulty in transportation, to get to and from a provider for outpatient treatments, examples, radiation and chemotherapy for cancer treatments and screenings. There's also an increased risk of alcohol consumption we've seen in women. And then we know that there are issues around triple duty, which is kind of women working off farm jobs to be able to provide maybe retirement or childcare or even healthcare access. So it's like you're stressed from both ends. You don't just have one job, you're working during the day and coming back and having to do other things in the evening on top of your family duties and responsibilities. So just a myriad of conditions that kind of contribute to some of those disparities. And then on top of that, just the cultural considerations. We know that working in agriculture, it's each family has its own set of values that are influence how the work is done, its socioeconomic status, the level of education, and then just cultural traditions of what women do on the farm or in agriculture versus what men do. And those things are kind of passed down from generation to generation, and sometimes they aren't challenged as much. So these values influence the division of labor on farms, women's potential exposure to multiple roles, factors contributing to occupational illness, fatigue, and agricultural injuries. And we really, really hope to be able to shift those things with more education and awareness around safety concerns. And some things in theory, we understand we can kind of present what those risks are and how a change perhaps in tasks or assignments can be made. But For some operations, that's a real stretch and it may not be possible. So I'm going to speed along. I've spent a lot of time on that introduction. So health and safety education is really where we're hoping to shift the needle in terms of women's health outcomes, or even just making them aware of what those risks are and how to better prevent those things. So safety education for ag has often been aimed at men in farming operations. And so over the past several years, AgriSafe has really tried to enhance our catalog of safety topics, from respiratory health to ergonomics, to really focus on women and what those specific needs are, because there are differences. We kind of do all of that under an umbrella of total farmer health, where we not only look at the typical traditionally hazards, has been kind of the area where all of the ag safety and awareness education has been, but we think about holistically, how does everything from where you live, the weather, the access to care, your social health and mental health, amount of sleep and stress with finances, how does all of that impact your health outcomes? And so here again are kind of very specific things by NIOSH, the National Institute for Occupational Safety and Health. These are numerous women's safety and health issues related to the agricultural job. So we've spent a lot of time looking at exposures to pesticides, chronic bronchitis, respiratory issues for non-smoking farm women. Pregnancy-related risk is huge because a number of people are working in this space and during the ages of reproductive health, and some things you do could have serious impact for years to come. Farm-related injuries, risk factors for female infertility in agricultural regions. So we really kind of spent time kind of identifying what some of those things are. In addition, we have looked at there are physical differences between men and women that put them at risk for farm injuries. So we've looked at ways to be able to get women fit for the farm work that they're doing. For example, we have things like Pilates and yoga. How do you get yourself fit to farm, if you will? We know that machinery build, especially with older farms that have older equipment, because of ergonomic concerns, that could be a serious issue in terms of injury and having the strength to be able to maneuver machinery as needed. We also know there's a correlation of tractor use and injury. Driving tractors on average for 1 day a week has been found to increase the risk of non-fatal farm injury. So big machinery safety has been a huge concern. Respiratory hazards, looking at that and really talking about access to personal protective equipment that is the right fit for the work that you do in the space that you need has been huge. We have a huge library of respiratory safety topics and information has increasingly been looking at women's access and how to get better fit on PPE, especially for smaller framed women. And then the issue that kind of rose to the top is stress on and off the farm. This information is over 20 years old, but not much has changed. So the multiple roles of off-farm work, living with that risk every day, work and life intersecting, and oftentimes women play the role of that safety officer. So having that information and trying to be the enforcer of said information has been really, really huge for women. And then this is just a quick mention of some of the adverse pregnancy outcomes for reproductive health. So dealing with herbicides, carbon monoxide, nitrate toxicity for formula-fed infants. So we're really thinking about those that have well water sources, then livestock, because you're often in those animal husbandry roles, so needle sticks, and then zoonotic infections. So just a lot of new information that we're learning and we're trying to get out to the broader population. Then here, just flipping the switch, we kind of do that direct safety training for ag producers, ag employers, but we also try to educate those rural health providers and provide tools for them to be able to have those conversations with their patients about what kind of work that they do and what are some of the risks. We actually have a ag risk AgriSafe health assessment that targets women and asks questions. It's a self-survey that women can actually do, print that out, take it into their provider, have conversations about the type of work that they do to make that conversation a lot more understandable and not rushed, to kind of come in and can have a planned out conversation about your occupation and how that impacts your health. We also try to share information about recognition and management of pesticide poisonings, but just very important considerations, not only during pregnancy, but before and after, kind of coming up with a plan. And again, sometimes that isn't as feasible as changing the person, but definitely if these are things that have to be done and a woman has to do them, they know how to keep themselves safe and protected. To that end, we have a number of resources for women available in our AgriSafe Learning Lab. This is kind of a new updated website that I think went live this fall, early fall, September, August, around that time. But it's a lot more user-friendly, not just for people who know what they're looking for, but it can be searchable by topic. We have a women's health page that lists a number of webinars, articles, and some of the resources. It'll click you back to our AgriSafe Learning Lab, where a number of those resources live. So this is information about some of the resources. Again, these are free downloadable PDFs that can be printed and shared and replicated throughout your network. So we try to provide these tools, and really, again, looking uniquely at what are some of those conditions specific to women to address. So I'll just kind of click through some of these. And this isn't an exhaustive list, but these are just some key resources that we have. And we continue to update and develop and evolve those items to fit the emerging conditions and new needs that we find as we continue in this work. And that is all I have. And I have 57 seconds to spare. I'll give the floor back to Athena. Thank you all so much.
Well, thank you so much, Knesha, for sharing that good information about women producers and about some of the resources that AgriSafe has created specifically for women. So I'd encourage all of our participants to use AgriSafe as a resource. There's a lot of great things on that website. So if you haven't been there, please do so. Take a look around. And I think you'll find some very good things. Now I'd like to go ahead and introduce our second keynote presenter, Casper Bendixsen. He's the director of the National Farm Medicine Center, which does include the National Children's Center for Rural and Agricultural Safety and Health. He joined the team at the National Farm Medicine Center after he earned his doctorate in anthropology from Rice University, where he studied the cultural values and ethics of U.S. ranchers. Bendixsen's current projects include the Wisconsin Infant Study Cohort, or WISC, which is conducted with the University of Wisconsin and investigates why children who grow up on farms have stronger immune systems. He's a national leader in working with rural firefighters to deliver agricultural safety and health information to their communities. And other projects focus on young farmers and ranchers, veterans, and occupational exposures involving the dairy microbiome. Bendixsen was raised on a farm and a ranch in Southeast Idaho. He worked as a cowboy, as a firefighter, as an EMTB, and he's the father to two beautiful daughters. So with that, please help me welcome Dr. Cap Bendixsen, who's going to share a little bit more about the farm kid paradox.
Thanks, Athena. Two beautiful daughters, one of which that just got out of quarantine from her class. So luckily it wasn't her fault, but she was out for 10 days. Thanks everybody for having me. I hope everyone's having a beautiful morning wherever you're at. I really wish we were somewhere in the Midwest greeting and meeting each other, but I'm very happy to do this presentation from central Wisconsin. I hope you find it relevant. I am going to zoom in a little bit beyond the general category of children in this talk. I'm going to stay a little bit closer to one of my projects because I think it elicits some important questions for our discussion today. I wear a couple hats. I direct the National Farm Medicine Center. I also help lead the Upper Midwest Ag Safety and Health Center and the National Children's Center for Rural Ag Health and Safety. And of course, as I make this presentation, I stand on the shoulders of greatness, especially in the category of children. I'm lucky enough to have Barb Lee right next to me, who everyone knows is the founder of not only the Children's Center, but really the national initiative behind farm kid safety. And Barb Marlinga, of course, and then the immunologists that I work with, the pediatricians that I work with that are also doing the heavy science of immunology work, like Jim Gurn and Chris Cerrugi down at UW. So we'll get into it. When we talk about children in ag, who are we talking about? We've got 2 million farms in the United States, give or take, and about 22 million people employed in the agricultural related field. That's owner operators and workers. And the one thing I would like to emphasize, especially for this panel, is that all the subpopulations have another subpopulation within them, and that is children. So the scalability of children at risk is wide. Specifically, we can think about those that are coming from Central America and Mexican immigrants. There's estimates that a third of them are children. And so as we talk about children, we have to think about, again, this is not just one community. This is many communities, all with the burden and the joy of raising kids who may or may not have the same amount of power and privilege as others. And so this is not an even landscape when we talk about children. The youth that live on farms that we know of, close to 1 million kids live on the farm. Whether or not they work there is basically half. And then we have another additional 250,000 that are hired to work on farms. This is recorded is paid to do the neighbor's work or some more formal forms of employment. And so these are the kind of different types of way a kid can be considered a farm kid. The other one is agritourism, when they visit farms or they host people on farms. So there's a couple different ways we can imagine a farm kid being defined. Where are these kids located? This is not just a US topic. There are kids doing agriculture across the globe. And in many estimates, when we talk about UNESCO and World Health, building on the great presentation before me, it's often women and children associated with agricultural work, whether that's feeding a family in a subsistence situation or in some sort of microeconomy or in a modern industrialized economy. So we have those to think about when we think about not just our own issues here in our regions and our states, but also globally. We can have a private family farm. There's no easy way to say small family farm, private family farm. These definitions are really slippery. But when we think about a family, nuclear family living on a farm, working that farm, that's probably the most common when we think about kids who are growing up on farms. And the primary problem here is we have to keep in mind that's an overlap between a home site and a work site, which that's unlike other industries, right? We don't necessarily live at a construction site or live on the road and things like that, although I would say that those definitions aren't necessarily as clean either. However, the overlap between families and farms is pretty wide in the sense that this is an American ideal. It's part of the American myth, part of the American traditions that we talk about in agriculture, is this family farm site. We also have youth employees, right? So they're located on farms that are not their own. They're located on farms where they are more or less familiar with things, whether that's the layout or the equipment or the animals. And then we have the children of employees. Now, this might mean the neighbor is a hired hand and has a 12-year-old kid, or it might mean that it's a migrant worker who's traveling with their family up and down a western or eastern seaboard. So the children of employees are also in this category. And so they may be located in Migrant Head Start, or they might be with their parents in the field. So these are important when we think about the locale of children. And they might be at work, or they might be at play. Many injuries, many fatalities, especially when we talk about younger kids, are simply bystanders. They're simply in the environment, in the occupational environment, ag being one of the most dangerous, where there's the most prevalence of children allowed. And they're simply playing. They're simply trying to enjoy beautiful weather, sliding down snow, whatever. And then there are tractors and different hazards sharing that space. They also might be visitors or tourists or hosts. And so we have over 23 million youth visit farms. We're just coming off of a great, wonderful fall. Lots of people went out and visited farms this season. And then, of course, as I mentioned, on the migratory and seasonal pathways. Now, so that's where they are and how many there are. What's the problem? The problem is injury and fatality. Agriculture is one of the most dangerous occupations in our country. It's the only work site in the US where children of any age can be present, infant to 18 or 21, depending on how you're defining children. High rates of injury. So every day, about 33 children are injured in agricultural-related incident. 60% of child ag-related injuries happen to children who are not working. These are, again, those at play, those are at bystanding, those are that are taking their lunch out to someone. And then they are deaths associated with children doing work that do not match their development level, meaning that they're being asked to do things that they're either mentally or emotionally or physically not capable of completing. And the number of ag-related youth worker fatalities is higher in ag than any other industries combined. So over half of the youth in the United States that have a fatal incident at work are working in ag. And I don't think that's a statistic that anyone can be proud of. And then, of course, anyone familiar with this category and the Children's Center knows the statistic where about every 3 days there's a child fatality in the US, whether that's work-related or whether that is not work-related. Now, gaining these statistics is very difficult. So some of these numbers are aging, but nonetheless, they are important to keep in mind when we think about what our goals are, when we think about this invisible at-risk population. So what can be done? I'm not a safety specialist. I'm a cultural anthropologist, but I have been learning some of the symbols and traditions of safety specialists. And I've learned that the hierarchy of controls is very important. And so when we talk about working down the hierarchy of controls in terms of what that means for a farm, now here's where I'm going to start drifting, I think, into a certain category of children, specifically the family farm children, but I don't want to forget the other groups, but I'm going to start drifting towards that group, just primarily that's where the project will lead us. In any case, we can physically change farms and how they work. We can take home sites and move them off and eliminate the hazards away from the home site and the work site, right? For physical separation. And this is happening. As farms grow and they accumulate acreage and stuff like that, all of a sudden, lots of people are living in homes that are not immediately adjacent to farm in a working environment. So it's not beyond the pale. However, it is uncommon for the working class or middle class farm to say that they could actually separate or eliminate certain hazards. So if you could do the work without a tractor, so on and so forth. And then that separation of work and play within the work site. So safe play areas is a common intervention that we advocate for. As we work down past the elimination, substitution, and engineering controls, we begin to get into the administrative controls. And this is really a dearth in the agricultural field. There's really no real firm labor laws. We only have a few that really can hold water. And so there's a lot of exemptions in agriculture for these kids. And child protection policies, right? So there's we can see that there's negligent and at-risk behavior, and there's really not a course of action for those incidents that result in a lifelong injury or fatality. The other administrative control we can think of is youth training and employee resources. We can think of things like FFA and tractor training and those different types of programs that have merit. These are great when they match the development level of the kids. And so this employer resource and youth training, I think, is important to keep in mind in terms of at what age and at what point is that administrative control useful. And then, of course, proper PPE. Most PPE is designed for adult men. And so these are all sorts of things that we need to keep in mind. And they're all not great fits at this point when you talk about PPE and training resources, because the kids are individual. In any case, we do a lot of work in the bottom half of this simply because there's a political arena which is not favorable for some of the other ones. Now, getting into the paradox. And so we know now I've explained, the primary hazards, and when we go over fatalities, we're really talking about tractors, and we're talking about engulfments, and we're talking about equipment. When we talk about injuries, we're talking about falls, and we're talking about livestock. So that's the kind of breakdown for kids, fatality, injuries, causes, agents, the causes of injury. But what we do know is there are some benefits from growing up on farms. So specifically with the Wisconsin Infant Study Cohort, we know that particularly mothers who spend time in a diverse environment set their kids up for having a healthier immune system. Specifically, we can see that farms where there's multiple species, feedstuffs, and the mother in utero with child in utero is exposed to these doing some work, that kid tends to come out into the world with almost no signs of a red itchy rash, atopic dermatitis. This atopic dermatitis is really the first sign of what's called the atopic march. So we know that the environments that lead to that come from these diverse environments halt the atopic march. When we look at rates of asthma around Plain Community and Anabaptist, it's almost zero. It's amazing. And when we think about asthma is one of the most globally debilitating diseases simply because there's no cure, there's only therapies. Some of the therapies are quite expensive, and they really debilitate an adult working community. So there's something about the farm environment that sets humans up for a healthier immune system. Now, on the backside of that, if you spend your entire life in the farm environment around feedstuffs and dust and stuff like that, we also know that later in life, there's an increased risk for respiratory diseases. So there's a back half, there's this kind of exercising of the human immune system. There's a great medical anthropologist, genetic anthropologist at the University of Chicago, Carol Ober. Her favorite thing is to say that every kid, every family should have one cow they raise their kid around until they're 3, and then they should eat it. So really this kind of idea as farm is therapy, farm is medicine, but really in a dose, not in this kind of prolonged environment like we're talking about with agriculture. And the other part that's really important about this is there are actually fewer and fewer diverse family farms. Farms grow, they tend to consolidate to one commodity. And so the amount of diverse small family farms like this are few and far between, which means that we're eliminating some hazards, but we're also losing the opportunity to maybe study that population and their health benefits. Now, those are measured. We can measure that with blood samples, cord blood samples, fecal samples. We can measure that immune development through medical records and through sampling. The less easily measured benefits are the social cultural perceived ones. So we have an idea in US society that farm kids grow up with a better work ethic. They're more responsible with time management, fiscally. They understand business relationships because they see the business transactions happen over the kitchen table or over the fender of a pickup. They have a better understanding of life and death because they see it in livestock. They have improved empathy because of the care for other living beings, stronger practical skills, problem-solving skills. There's some belief that the idea that because of their exposure to ag, they have a math and science disposition. So STEM and ag education is a unified field. If you look at FFA and 4-H, and they have an appreciation for the food system, which is a depreciating skill. A lot of people don't really understand where their food comes from. The challenges with measuring this type of stuff is the parent bias. But generally speaking, parents tend to think their kids are stronger, faster, and that their home is safer than the other home. This is true in ag as well. They actually perceive their farms as safer than they are. And then there's a running tradition of rural and agricultural exceptionalism, right? If you're something about being country, it makes you tough. Something about being rural makes you healthier, especially when you look at your cousins who live in the suburbs. And these are common stories. The bias in this idea of what is good for a kid can be temporary, right? Because it can all go away with one mistake. It can all go away with some sort of alteration in the character or the work of that child. And it's retrospective. It's the parents that successfully raise the kids safely that are telling us these stories, and they're building it up. There's also a social acceptability bias, right? We want to be amongst the strong, independent rural class. And so our kids are also going to be part of that. So that's an esteem issue. And there's a self-serving bias, right? We want to have confidence in who we are. And so we'll answer questions in a confident manner, even if they're not entirely factual. And when we think about this, parents do it just in general. I do it. We want to build up and think that we're doing something right with our kids, and we're proud of when it happens. As a farmer, there's a small class of people that actually take on this work. And as a rural person, the rural urban divide about, who has a better education, who has more cultural identity, so on and so forth. So these are challenges with measuring the perception. If we continue down the road where we have a lack of child labor policy, we lack things like rural child care facilities and affordable child care. I know Florence is hearing that one. If we lack punitive measures for neglect or reckless behavior of adults, then we will have to move through the perceived benefits and social esteem. And I think they may be the strongest barrier towards reducing injury and fatality. Really, it's a strong motivation to not pay attention to the risks or the chinks in the armor. More so, what if the biological and the social cultural benefits are real? What if there's a legitimate case and the parents already believe it's real? So, I mean, perceived is one thing and it's real to them, but what if they are actually real? What if we could measure some of these social benefits? And they felt as though, some of the risks were worth it, which I think is a really dangerous phrase coming out of this presentation. So the farm kid paradox, we have this overall goal to discover how parents, specifically on beef and dairy, primarily because we know that's the immunological benefit, but it also, cattle are causing some of the most injuries. So we have this burden of livestock and child interactions causing injury. But we also know there's biological benefits as well as some perceived social cultural benefits that are less easy to prove. Nonetheless, we know we have some biological. And so we have the farm kid paradox. It seems like there's something to be gained and lost at the same time with a child-cow interaction. The conflicting information, this conflicting is probably incompatible with cultural values and other sciences. It's confusing for a parent. What should I believe and what should I build on? And so injury interventionist materials and their injury interventionists and their materials need to account for these cultural values and medical facts. The impact is maybe we can improve the messaging. Maybe we can work with the agents of change in a community in a manner that not only celebrates the benefits, but prescribes certain behaviors that reap the benefits, but mitigate injury and fatality. So we're using semi-structured interviews, some free listing. There's going to be a mixed methods approach that I won't spend a lot of time on this, but we're using a couple different methods where we're learning about risks and benefits and activities for kids on farms that have both quantitative and qualitative measures to them. And I'm happy to talk about these more if people are interested. But we don't have child injury preventionists all over the country. So we have to look at who's in the community and who can we help with this information. So we're working with groups like extension livestock programs, safety professionals, looking at childcare centers and booster clubs and veterinarian moms, and then obviously the parents. Whether or not we have any overlap with people who are close to the parents is probably true by the nature of the communities, but this is the group we're really targeting. And we know that from the work of the National Children's Center, working through these different levels of the SEM is a sound public health track of research and intervention. I won't spend a lot of time here, but we have a great team here in Marshfield as well as at Kansas State. Probably too many anthropologists, but what the heck, let's do it anyway. So we have a team of anthropologists down at Kansas State, Trevor and Ryan Kladsky. Really happy to have them on board. Kate Barnes, and we have Kyle Kashalik and Bernie Kiki. And then we have some great external advisors, Dave DeFreight, which I think a lot of people here know. And then Kim Fortune, who's actually a great anthropologist of risk and human health at UC Irvine. A little trajectory on our website if you want to go see more of what we're doing in our partnerships. What I think is really kind of relevant here is we've got a lot of attention for doing this project. We're only in the first year, but I think people are gravitating towards it because they realize the ag audience wants to hear about this idea of can we pay attention to risks and benefits. So immediately we had a great kind of interaction with ag media. And right now we've started our interviews about halfway through. Some early results from our dairy parents. Some of them are talking about the farm as a parenting toolkit. So you can see the quote there about this idea that how can we use a farm environment to teach and learn, become stronger, faster, those kinds of things. But again, we have to keep our hazards in mind, but they view the farm as a parenting toolkit. I think we all imagine our neighborhoods as places where we have resources or a lack of resources to help us raise kids. And then there's experimental learning going on, meaning that the parents are learning as they go. This is a common theme across parenting. With the first kid, I did this. With the second kid, I did this. The trouble here is we're doing it in a work environment, a dangerous work environment. So learning as a parent has more risks in this environment, but nonetheless, they're like any other parent trying to make their best from one kid to the next. On the beef parent side, they have a desire for skills training, not safety training. They want to be able to teach something, not restrict something. We have ag youth work guidelines, which are really akin to this idea, meaning they work on child development and mental and emotional stability so that they can be assigned the right work. I think the expansion of that is how to do the job and get the benefits. So what they should be learning as they do the activity safely. There's a definite sentiment that there's a gap between not just farmers and safety professionals, which is one of the points of the project, but they feel that there's a gap between broader society. And then there's some off-farm influence on safety ideas. That, for instance, if they work at construction or something like that, they might bring some of those good or bad habits home. I'm running out of time. One of our problems that we're enduring right now is where's the safety expertise? They're saying we do it ourselves. When we talk about the SEM, there's organizations and possible agents of change. However, resolving the gap between an injury prevention researcher and a parent may not be one-to-one, meaning that we have to figure out in a region who those agents of change could be and who can they deliver that safety knowledge and what format do they need? How can we better enable those relationships? Lastly, I'll say the farm kid paradox is not generalizable for all children. At-risk populations may not have any sort of power to do this kind of fine balancing act. I think specifically when we talk about racial minorities or socioeconomic minorities or migrant and immigrant status, they don't have nearly as much power as a family who's making these decisions on their own property with their own machinery, so on and so forth. What are the upper limits of risk taking? Even if all the benefits are real, fatalities and lifetime injuries are beyond the pale. So it doesn't all pass, right? I think that's something we need to keep in mind. The upper limits of risk taking are still something we need to resolve. Where does this path take us? The future of child injury prevention in terms of voluntary education, things like that, may not reference safety knowledge in ways that we've traditionally known it. We may have to be much more prescriptive about what we're telling parents to do with their kids. For those interested in tracking child fatalities and injuries in ag in general, I invite you to go to aginjury.org. This started as a Children's Center project tracking child fatality in the news because of the lack of a systematic database. So please use that as a resource. It is searchable. You can get alerts. The CASA network through Marcia Salzwedel, if you're part of that, obviously you'll know that you'll get a number of reports. CultivateSafety.org, we've got lots of evidence-based materials that I invite everyone to look at. And our standard brochure, this is the one pager about why this topic is important for work in the United States. Some references, and I'm done. Sorry for going over a bit.
You're fine, Cap. I think we're all excited to hear the information. Look forward to all of the great information that your project is going to bring forward across the next couple of years. So I know I'm looking forward to what the Farm Kid Paradox will teach us. So thank you for your presentation. I'd like to now introduce our third keynote panelist for this morning, Seth Holmes, who is an associate professor at the University of California, Berkeley School of Public Health's Community Health and Human Development Division and the graduate program in medical anthropology. He's the co-director of the MD PhD track in medical anthropology that's coordinated between University of California, San Francisco and University of California, Berkeley. He also co-chairs the Berkeley Center for Social Medicine, and he's currently investigating social hierarchies, healthcare, and the naturalization and normalization of difference and inequality in the context of transnational U.S.-Mexico immigration. This is the project that led to the publication of the book, Fresh Fruit, Broken Bodies, Migrant Farm Workers in the United States. So for those of you who haven't read it, I'd encourage you to read it. It's one of the best books, best ethnographies that I've read. And with this book, he really spends a lot of time talking about these structural issues. And I'd like to just quote a sentence from the book. The reproduction of a system of migrant labor hinges on the inability of migrants as individuals or as a group to influence the institutions that subordinate them to other fractions of the labor force and to the employer. And I know Dr. Holmes will talk about these structural inequalities briefly this morning, but I'd encourage you to check out the book. And in addition to the book, he's published numerous academic articles and written about his research for Salon.com, Access Denied, the Huffington Post. He's been interviewed all over the place, NPR, PRI, Pacifica Radio, and Radio Bilingüe. I'm really, really excited to hear Dr. Holmes this morning. So please help me welcome him, and we will turn it over to him. Thank you. Dr. Holmes, I'm sorry, I might be the only one, but I am not hearing you.
Now I'm unmuted.
Okay.
Thank you, Athena Ramos, for inviting me and the whole MRASH conference. And the first two presentations were wonderful. They were very good presentations about important things for us to understand. So I'm going to be talking about farm workers, some now, a little bit in general, and then partially focused on what's happened over the last year and a half that's highlighted some of what we already knew related to farm workers. And so do you see the slides, or do you see the presenter view?
We see the presenter view.
How do I, here, let me try
on
that.
The swap displays. Yep, now you're good.
Okay, all right. So one of the things that I learned in doing the research for the book Fresh Fruit, Broken Bodies that became very clear to me and still informs a lot of my research is that everyone's health, all of us listening to this talk, we all, our bodies, the fact that we have energy in the morning to come to this conference, the fact that we have energy to do any of our work, the fact that I have energy to talk to you is dependent on farm workers. Many of those farm workers are migrant farm workers. Many of them come from other countries. Some of them are undocumented, and their work provides us with the food that our bodies need. Literally, many of the molecules in our bodies would not be there without farm workers providing us with the food that we need. So our health depends on farm workers. At the same time, it's very clear that the labor that goes into farm work is very difficult on bodies. It causes health inequities, both physical health and mental health. And I've listed some of them here. Some of them are increased injuries. Some research shows up to 10 times higher than national average in other work categories. Chronic pain, heart disease, cancer, stillbirth, many infectious diseases, diabetes, kidney disease, anxiety, insomnia, and perhaps most painfully, ironically, malnutrition. So more than half of migrant farm workers themselves providing us with food, all of us with the food we need to eat, are experiencing food insecurity. More than half of them have been hungry and not able to eat enough food, not able to provide enough food for their families in the last month. We also know that mortality, death directly from the work on farms is 5 times higher than the national average in other worker categories. At the same time, there are health care inequities. The rate of insurance of farm workers provided by the employer or provided some other way is very low. And many communities, many counties don't have public hospitals or clinics that are open to everyone. So the farm workers are dependent either on their families or other people to take care of them without having access to healthcare, or they're dependent on a federally qualified health center, a migrant health clinic, or another kind of health clinic that has sliding scale. And many states, more than half of the states in the United States, exclude most migrant farm workers from workers' compensation benefits if they get hurt on the job, even healthcare. So I think all of these things we need to take really seriously, because our own bodies, our health is really linked to the health and the bodies of farm workers. And it's unfair and unjust that our health benefits and we don't provide healthcare for the people who are working very hard for our society. So I want to bring in a concept called structural violence from a physician, Paul Farmer, and many others who have written about it. Paul Farmer's group in the medical journal PLOS Medicine defines structural violence as one way of describing social arrangements that put individuals and populations in harm's way. The arrangements are structural because they're embedded in the political and economic organization of our social world, and they're violent because they cause injury to people. And I'm just highlighting one article in the New England Journal of Medicine that takes this concept to think more deeply about the health of farm workers specifically. So the idea of structural violence is that there are these inequalities in society that come from policies, come from economic systems that produce inequality, come from things like institutional and structural racism that lead to poverty and inequality and then lead to health inequities. Many of us who are physicians, social scientists, are working in this framework that we're calling structural competence. And within this framework, we're trying to understand how these social structures produce health inequities and how we should respond. So during the pandemic, migrant farm workers were declared essential, which in some ways may have, and many of them were given letters that said that their work was essential, and they were told to keep these letters with them. But in essence, this made it so that farm workers had to work, which in some ways was good. They could continue to work and provide money for their families. But in other ways, as some research, the COVID farm worker study in Washington State, Oregon, and California shows, many of the farm workers on different farms were not given personal protective equipment and not allowed to physically distance. Last summer, early in the pandemic, I volunteered with Doctors Without Borders and the Coalition of Immokalee Workers and Partners in Health in Immokalee, Florida. And what we saw there that's similar to many other places is that the living conditions are not helpful for COVID. Many people who are living in farm labor camps are living in very crowded conditions. They're being transported to work in crowded vehicles, and they're being asked to buy their own personal protective equipment. Or we even saw some farm managers and supervisors were ridiculing people who did wear personal protective equipment. So in Florida and many other places in farm labor, we saw COVID cases rise. And in Florida, I was working in testing centers and getting to know people who were being tested and got to know many families who had farm worker family members who died during COVID. At the same time, you may remember that there weren't enough N95 masks for healthcare professionals who were working in clinics and hospitals. And at the same time that was true early in the pandemic, ICE was bidding on tens of thousands of N95 masks and taking them with them to perform raids. And there were many examples of raids that led to further spreading of COVID, and there were detentions and deportations that led to COVID being spread to other countries. And much of this affects our farm worker communities. At the same time, there were really impressive community responses that I saw in Florida and have seen in California and other places. The Coalition of Immokalee Workers engaged in public health education campaigns in Spanish, in Haitian Creole and English. There are different community organizations, the Centro Binacional here in the Central Valley of California, and other groups that produced public health information related to COVID and then later related to vaccines and where to get vaccines, and many different indigenous languages, because there are many indigenous languages that people speak. Many of the people I work with who are farm workers do not learn Spanish until they move to the United States. In Mexico and in Guatemala, they speak an indigenous language and they learn Spanish in the United States in order to work in farm work. There are many different radio stations that are bilingual that were answering questions and giving information related to COVID. The Coalition of Immokalee Workers was giving out reusable, washable masks that many other organizations were sending them in the mail. And then partially due to organizing by the Coalition of Immokalee Workers, Partners in Health, and the Florida Collier County Department of Health and other groups worked together to start paying community health workers to work among farm workers. What we saw for the first several months of the pandemic was that, for example, in Collier County, where Immokalee is located, there was a great deal of testing being done in the coastal towns. And the coastal towns, by and large, are wealthier and more of the people are white. And the rates of COVID cases are much lower. And there was not very much testing being done in Immokalee, in the inland areas where farm workers lived. But with organizing by the Coalition of Immokalee Workers, Doctors Without Borders, and getting the Department of Health and other organizations working together, there were testing centers started after the first few months. Here's some of the names of some of the organizations. The press in Southwest Florida called it a dream team. The coalition made by the Coalition of Immokalee Workers, Partners in Health, and Doctors Without Borders, doing testing and working toward health equity in the time of COVID. And I think the quote from Gerardo Reyes is really important. To build something that makes sense, what you need is the people who are suffering the most to be part of crafting it, because they're the ones that know what it is that's failing. There were also inequities in contact tracing, with a great deal more resources going to contact tracing in the wealthier and more white communities where there was much less COVID and much less need for contact tracing in many ways. But in the inland communities where the farm workers were living, there was a lot less contact tracing. And again, this community organizing pushed for equity and brought different groups together in a coalition. There were also inequities in resources for isolation. The first several months of the pandemic, there were hotels that were rented by the state that were located in the more wealthy communities that tended to be more white people. And there weren't resources for isolation for farm workers, even though the farm workers were the people who were living in more crowded conditions and needed the possibility of isolation. Again, a coalition of people organized together to try to change this. And then one thing that I found very interesting and helpful, which I have appreciated for a long time, is the organization Migrant Clinicians Network has a program called Health Network, where public health providers, social workers, medical doctors, nurses, if they're working with a patient who is mobile, who's moving, they can sign this patient up with Health Network, and then they're assigned a case manager, like a medical social worker, who follows them on WhatsApp, on text messages, on Facebook, to help make sure that they get any test results they need, that when they're moving to the next town to work in another farming area, they can get information about where a clinic is that they have access to. And their medical records can be transferred from where they were working in a previous season to their next season. And here's an article in the New England Journal of Medicine about this, the importance of programs like this that help link healthcare for people who are mobile. And from all of my research in my, maybe 15 years of my career, what I've been seeing and what I would argue and what I've heard from the Coalition of Immokalee Workers and other farm workers is that we need stronger health systems for farm workers. We need clinics that farm workers have access to, and we need to fight for migrant farm workers and all immigrants to have access to health insurance. In the health professions, we need something like structural competency so that we avoid doing what unfortunately we're often trained to as clinicians, and that is seeing health outcomes as the result of either individual behavior choices or genetics or biology. And many of the health inequities, or maybe all of the health inequities that I've talked about today, are caused by social, political, economic inequalities or social, political, and economic structures, and not caused by individual behavior choice or genetics. So we need to start understanding that and acting on that and pushing for change in those areas. Another thing that became clear to me during COVID was we need to build coalitions of different groups. We need to organize together. In Florida, what it took was a mix of Coalition of Immokalee Workers, the farm worker organization, Partners in Health coming in, even though primarily they have worked abroad in the past. Doctors Without Borders, I believe it was the second time in the history of Doctors Without Borders that they've worked within the United States. And it says a lot that they came to a farm worker community saying it's clear that this community is not being taken care of. And so we, who usually work in other parts of the globe, are coming here to the United States to take care of this community, since the state and the county and others are not. And it was very important to have all those different partners involved, including getting the county health department and others as part of the coalition. And then I think what Gerardo Reyes said in the quote earlier, it's really important that farm workers, their own voices and their community organizations are included in decision-making about what needs to change in work safety, what needs to change in who has control over decisions about what work looks like. Their voices need to be prioritized in decisions about how do we deal with physical distancing while working? How do we get personal protective equipment? And in planning things like how will migrant clinics work? How will insurance systems work for farm workers? So with that, I'm happy to pass it back to Athena, and I look forward to discussion later.
Well, thank you so much, Dr. Holmes, for sharing your experiences during COVID, especially with the Immokalee workers, and also for highlighting the resource that Migrant Clinicians Network offers to people who are working in this space. I think your 4 points on where you ended, that we need to ensure access to healthcare and health insurance for farm workers, really try to promote that idea of structural competency and really think through how we build equitable partnerships that value the voice of farm workers and the experiences of farm workers is really critical. I know in the community engaged research world, we spend a lot of time talking about building those equitable partnerships and trying to develop more of a process where we learn from each other, that we recognize the community as experts in their world, and we also bring some expertise, but we collaborate and we build together, starting on the assets, building from the assets that the community already has at their fingertips. So I think you highlighted today the importance of having more of a long-term view of the world and trying to really engage, I think, with farm workers, particularly in your case, migrant and immigrant farm workers. So thank you so much for highlighting that this morning. Now I'd like to go ahead and move on and introduce our fourth and final panelist for this morning. Sean Baer, who is the co-director of the American Indian and Alaska Native Addiction Technology Transfer Center at the University of Iowa. He earned a BA from Buena Vista University in 2002, where he majored in psychology and human services, and he also studied mental health counseling at Drake University for 2 years. He's a member of the Meskwaki tribe in Tama, Iowa, and has worked with Native Americans with substance abuse disorders for many years. He's an Army veteran of 9 years and received an honorary discharge from the 82nd Airborne. He has experience in building holistic Native American-based curriculum and implementation with substance abuse clients. His passion is to assist people in overcoming their substance use issues and to return to the spiritual ways of their ancestors. It is his hope that one day people with all nations will coexist and live in peace and harmony, not just with each other, but within themselves, as well as to come to the realization of what our ancestors of long ago already knew, that we're all brothers and sisters under one creator. So please help me welcome Sean. We can't hear you quite yet, Sean.
Okay, thank you, everyone.
Yes, we hear you now. Thank you.
Yeah. That was an honorable discharge. It's actually my, I think, third one. Yeah, I'm from Tama, Iowa. I'm part of the Meskwaki tribe. I've been asked to do this presentation here. Let me move this over here. Can you still see the slide or the PowerPoint?
Yes, we see the PowerPoint slides, but they're not in presenter view, so we don't see the full view of the slide that you're currently on.
Well, let me do this a little bit different here. Why this one here is. Okay. Okay, so I'll start out. What I titled this was Native American Traditional Agricultural Practices. Actually, the word agriculture doesn't really fit with Native American traditional practices. As many tribes were not always in one area, but would move around in different areas. And a lot of times they based upon this around seasons. And as seasons changed, like there might have been animals in certain areas, so they might have been there. There might have been certain times of the year where there were medicines and things like that growing in other parts of the area in which they kind of moved around. But our planting normally was kind of like more around a base camp and picking the best areas in which to plant from. That's the one thing I wanted to be able to talk about that, is because our practices over time have kind of changed. Before we were able to move around a lot more, but over time it's like I think from history, we know that that became a little more impossible. Our agricultural practices, a lot of times they were seasonal, like I'd said, but among many other practices that we've done, that we did, like what I mentioned about picking medicines and hunting and things like that. We had utilized like a selective breeding led to today's crop rotation today. A lot of times people don't always understand that, as they had seen us growing corn along with beans and squash at the same time. And they realized that beans had helped replenish nutrients in the ground to help things keep growing over time. Of course, corn had derived from Central America more with what they found maize. One of the practice that we did have was called the Three Sisters, and that was corn, beans, and squash all grew up at the same time. So normally they started with corn. It got so high, they had grown the beans in along the rows, so they had support from the corn, but also to replenish nutrients in the earth. And then they grew squash down the center of the rows of the corn. It helped to keep weeds down and things like that. Also, some of that, what they had found in the Americas as well as when they came, was also pumpkins, sweet apples. From Central America came maize, papaya, chocolate. One thing they did realize is that in further studies, they found a cave in New Mexico where the natives there had kind of stalks of corn there. They had like 2,500 years ago. From South America came avocados and pineapples. So I'm talking about more of like the natives of the Americas in a sense, because I believe that so much is that, you know, this was one continent at one time, and we know that in the Guadalcanal was man-made. So I like to think about, you know, also relatives from those further lands, such as even Canada and South America. Our livestock wasn't as much livestock as they are thought of today. Of course, later on became sheep, which they had raised or watched in the Southwest, but they had more let them graze, a little more wild. Adds a little bit different taste to it, but you know, it tastes a little more wild, like with the mutton. Animals were allowed to live in their own normal environments, of course. That's so that we could hunt them. They had freedom, things like that. Not all people always realize, but you know, thinking back about it, is that dogs came from domesticated wolves, cats came from domesticating wildcats, and sheep derived from another animal, more like a mountain sheep. Long ago, they had began to breed them into what is now called sheep, the sheep we see today, but they weren't white. Over time, they began to check on the color and to build to breed them like that, because it was easier to build to dye the more of the lighter colors into other shades, so that they could make wool or clothing and things like that. Cows derived from wild cows. A lot of times when we look at what some of the tribes have today, a lot of times they might also have buffalo and elk and things like that before they had roamed free, so we hunted them. But today, some of the tribes also have these, which also helps in keeping and retaining their populations. We look at genetically modified organisms and GMOs. When we look at indigenous foods today, And in the past, our foods before were more of how, I guess the food today, how we see corn is more of how some people today see away from unhealthy food, the white foods list, which is a list of foods that have a lot of carbohydrates, sugars, or processed foods. A lot of times you see them as very unhealthy. We look at foods that have become very common among many people in the world, where over many generations, their systems have become accustomed to those. You know, like corn, we think of corn today, and many people think, oh, the yellow corn. But that wasn't the original color of the corn or the size or anything like that. So a lot of times when we think of some of these things, we actually kind of consider them more like GMOs themselves, because they were genetically altered over time to become sweeter, larger, more filling, to be able to bring more money into for farming and such, agriculture. Corn was later taken to Europe. So a lot of times with our corn today that we grow on our land is that we have traditional corn. And what we say is that it has everything we need in order to live, even if that was the only food we did have. So when we also look at things like potatoes, they were once very small, now they're very large. Our tobacco was not abused yet. Today they're, you know, they've been kind of altered for the nicotine and become commercialized. When we grow our corn now, we have to make sure that we're growing it more in the middle of our lands and not on the outskirts, because they can be pollinated by those corn outside the tribe. And a lot of times we might see that and discard those seeds and things like that to make sure we're not planting those. So we really try to keep our corn as much original as we possibly can. And this was something that we were kind of instructed long ago, to be able to grow the corn, to keep it like that and keep it healthy. A lot of times what we talk about when they're looking at that is what we call the three sisters. So that is a knowledge that's kind of spread to other regions of the America today. However, we see it coming from the Southwest, coming through the middle of the United States and up again into the Northeast. And along with the three sisters comes other tribal practices that are not always kind of noticed, but we're able to kind of pick that out. See, when it comes to like other animals and such like that, of course, when they came here, they also found turkey, various deer, squirrel, rabbit, things like that. When we look at also with indigenous knowledge, it's something that's being used within science and many things today. One of the things is that they say 70% of all medication derives from indigenous knowledge of herbs, plant, trees, flowers, etc. Such as the anti-cancer medication and treatment for cancer derived from the periwinkle and yew. Anti-malarial medication derived from wormwood and sagewort. Pain medication, of course, many people learned that aspirin was derived from white willow bark. So a lot of times when looking at indigenous populations, they realize that some of the practices that the indigenous people still have can be utilized and kind of studied to find out what exactly is helping certain peoples with illnesses and things today. There's even parts of the corn and things like that can be utilized as what we would say medicine, because our medicines are, of course, they're comprised of pretty much everything we do in our life. But when we're looking at like physical things that are like herbs or different kind of remedies, people might say, that we can make teas out of, or salves, or many different other kind of things to be able to help treat an illness or sores or sickness, however it might come. I know that before they had talked about things that we're worried about today. And one thing that was brought about was weather change. It's not really a new concept for tribes, but it's something that we have kind of kept an eye on. I know that prophecies have kind of been passed down from generation to generation for so long that some are now being very brought about all over. Like someone might have heard about the 13 grandmothers, the prophecy of the 13 grandmothers, seventh generation prophecies, 8 fires prophecy, which some also call the 7 fires prophecy, intertribal prophecies, but not always known to all people within the tribes, of course. But also there are prophecies of sickness. And a lot of times we look at these things and what is coming and what needs to be done. But these are kind of what I have listed here are examples of those. But when it comes to the 13 grandmothers, it's really interesting because when I heard about this, and it was like 1995, one thing that was included with the prophecy of the 13 grandmothers was the 7th generation, but also women becoming leaders and taking more of a stance in helping the environment, helping Mother Earth, helping and throughout everything. And after that, it was really neat to be able to see that how women were becoming more in leadership. They were bringing about all these issues that people really need to hear. And I was happy about that because a lot of these prophecies, it's really good to see them being fulfilled. And when I was a little child, I grew up learning like older traditional knowledge and prophecies, things like that from my great grandfather and his teachings. I was told many things about the cultural traditions, the spiritual practices, the beliefs, but I was also told the prophecies. But later on, it really helped me in my individual studies, in a sense, for from the time when I was a child to growing up, I was really looking for certain knowledge. I really looked at prophecies and wanted to learn more and more knowledge from my elders and stuff like that. Of course, I had some difficulty because in our culture, we are not always allowed to ask questions of our elders, but I did so anyway, but eventually I had to learn how to ask the questions correctly. So that was something that I really had to learn. When I was back from the military, I began to travel throughout the United States, seeking out many different medicine peoples, learning from them and hearing many more prophecies and knowledge that coincided with what I have already heard, and realizing that many of these prophecies are kind of more widespread. And there's so much more in common among the tribes that people realize, but even though they look different, the languages are different. They might say these things a little bit different, but the spiritual practices are pretty much very similar. And of course, I was also taught about like the sun and different things like that. So I always watched the seasons, always watched shadows, looking for ways in which I could tell the time if I'm out in nature, to be able to look for many different things. But in early 2000s, I began to see a great change in how our shadows were moving. When I was very young, I always noticed that the sun came up pretty much exactly in the east and set exactly in the west. But over time, we see many different things changing, and how that any parts of the years that the sun might come up in the northeast set in the northwest. And I noticed that shadows began, or the sunlight began to come in on the northeast side of the house in windows that it never had come before. But I had began to talk about this to like different medicine peoples and things like that, and talking about these old prophecies and things that were coming. And many of these, we're still waiting on. The sickness and stuff that we see today, I feel, are the same prophecies that we're told of the sicknesses that were coming. So that's something, it's like we do pay attention to the weather changes. We do worry about that a bit. Pollution, of course. What we've noticed is that current agricultural practices and the intensity of growth has contaminated rivers and streams in the ecosystems. Hard rock, uranium mining has contaminated underwater channels. You'll see or hear that dumping of nuclear waste on or near indigenous lands has caused cancer, leukemia, female sterilization, miscarriage, stillborn, and birth defects. Corporations upstream of communities have polluted rivers and streams. I know that the Iowa River, sometimes it keeps fluctuating, but it's many times either second or third most polluted river in the United States, with the most polluted part of that in Marshall County. So a lot of times when we look at it, we do worry about things like that, because we have to make sure that our water supply are clean and healthy for not just us, but of course our children and future generations. It's something that we do talk about, but there are other ways in which we could help to stop a lot of that. And like I had said about before, being careful of our corn, in the sense being pollinated by those outside our tribe is a concern. I'm part of a culturally linguistic appropriate standards for class standards. We talk a lot about health equity, but I think a lot of times when working with tribal lands, people are not always aware that within the laws, there are federal laws, state laws, but also tribal laws, especially when you're working on tribes or near tribes, is that those kind of laws do come into effect. And it's kind of strange as people might think, but it wasn't that long ago. I was still a child when the American Freedom of Religion Act came about, and I realized later on that of why my parents and grandparents and people would tell me not to tell people what we do in our ceremonies. And I hadn't known that a lot of times they were illegal back then, but in 1978, we're allowed again to practice our ways and stuff like that, the way that we wanted to or should be able to. But the biggest thing about it is our belief systems, our spirituality is inseparable from our heritage. It's kind of like who we are. And it's about our traditions, spiritual things, ceremonial practices, and knowledge. And there's so many different things that the tribes and indigenous peoples around the world have that we could help, in the sense. A lot of times I think we just need a voice, and caring for people, not just our own, but for everyone, is very important. I probably went a little fast, but thank you.
Thank you so much, Sean, for sharing with us this morning and talking about some of those cultural, spiritual, historical pieces of information that I think are not so well known within our agricultural health and safety community. So we appreciate your time this morning and for talking about the importance of health equity and culturally and linguistically appropriate types of activities. Now we have an opportunity for a reflection from our two rural sociologists that I had mentioned this morning in my introduction. So I'd like to go ahead and introduce them right now. First is Cornelia Flora, who's an Emerita Distinguished Professor in the Department of Sociology at Iowa State University, where she served for 15 years as the director of the North Central Regional Center for Rural Development. She's a research professor at Kansas State University, where she served as director of the Population Research Laboratory. Other positions have included program director for the Agriculture and Rural Development for the Andean region and Southern Cone in Latin America for the Ford Foundation, and chair of the Department of Sociology at Virginia Polytechnic Institute and State University. She's published 13 books with a 14th in preparation, and served as the president of the Rural Sociological Society, the Agriculture, Food, and Human Values Society, and the Community Development Society. Her BA is from the University of California at Berkeley, and her MS and PhD are from Cornell University. Joining her is Jan Flora, who is an emeritus professor of sociology at Iowa State University and a research professor of sociology at Kansas State University. He's the co-author with Cornelia of Rural Communities, Legacy and Change, another one of my favorite books. I'm glad I get to meet lots of authors this morning of my favorite books. He and Cornelia also consult with the Federal Reserve System on indicators of community capitals, which I'm sure they're going to talk a little bit more about this morning, and the Community Reinvestment Act. He studies Latino entrepreneurship and the contribution of dual language programs in Iowa. And many moons ago, he shared with Cornelia a position with the Ford Foundation in South America as the Agriculture and Rural Development Program Officer. He's done research and consulted in lots of different countries in Latin America, as well as in Uganda, Kenya, Malawi, and the Cape Verde Islands in Africa, and in China and Australia. He's taught courses on rural development in Spain and Peru. He speaks fluent Spanish. Portuguese is a little rusty though, and his English, of course, is improving. Jan is a passionate volunteer with Mid-Iowa Organizing Strategy, AMOS, an Industrial Areas Foundation affiliate, and currently working on housing instability in Ames, sustainable livelihoods for low-income adult workers, and in support of rational immigration policies. He's on the board of Project Iowa, a wraparound jobs program for low-income adults, the Land Institute in Salina, Kansas, and the Child and Family Policy Institute. So with that, I want to welcome the Floras to provide a reflection on the 4 keynote presentations that we heard this morning.
This is a real pleasure. Do you want me to share my screen, Jen? Because I add a little bit. So close yours. Sorry. At any rate, I'm trying to share my screen. Don't know if it's happening or not. But we're going to look at this in terms of the systems. And I'm very appreciative how all the presenters looked at the systems in which the humans are embedded. And we use a community capitals framework. Maybe you better share yours because mine's not working. So, sorry. So we look at natural capital, and we see how this is changing so rapidly with climate change, which is impacting agriculture particularly. And as was pointed out, this really hurts farm workers and farm workers in the food system. And it also impacts how agriculture is done. My major work with indigenous communities in the United States has been with the Hopi, although I am now working with the Ho-Chunk a bit with their tribal college. And the thing that was impressive is this was okay, that's not the screen you're sharing. That was the, that as the colonists came through, we called them settler societies, and took over the best land, the indigenous people were forced to go to less and less and less favorable land. Put in slideshow. And therefore we see that the Hopi were always on very arid land. Slideshow. Just move your, sorry, we're discussing how to share the screen. And so the natural capital that many indigenous people have access to is very problematic in terms of what it offers environmentally. So this is our framework that I'm going to talk about, which is the, you don't have belt capital up yet. But everything must start with natural capital. And we see that agriculture, even in the Midwest, greatly varies by where you are, north or south, east or west. And it provides the possibilities and limits to human action. And it influences and is influenced by human actions. Go back. Next is cultural capital. And I was very impressed with how well everyone dealt with cultural capital. It has to do with how we see the world, what we take for granted, what we value, and the things we think possible to change. And I was particularly interested in the last presenter who showed this intersection of the natural capital and people's appreciation of it. And this can vary a lot among farmers. At Kansas State, I taught a course in how we about sustainable agriculture, and I had a sustainable farmer come and talk. And one of my students, after he left, said, I was just amazed on how he loved the land, whereas their parents looked at land as something you conquer, as the enemy, rather than working with the land. And when you work with the land, perhaps you use less aggressive machinery, things that are less aggressive in terms of health. The other place where cultural capital comes in is the tendency to view a hierarchy based on gender and ethnicity. And so therefore you have sexual abuse because that's what women are for. And you don't really worry about the health of farm workers because they're not us. And so we need to really look at cultural capital and what are our assumptions about people and from various places who aren't like us. Cosmovisión is a Spanish word that really means this intersection of the seen and the unseen. And again, our last speaker brought that forward very well about, and it leads to how do you see things relating and what causes what? The food and language. And what is interesting about many native peoples and agriculture is the understanding that what you eat determines your health. And we've seen this sad situation where the farm workers suffer from hunger. Whereas what you see on many reservations, and I see this particularly at Hopi, which is where agriculture is very problematic, but they have kept their traditional crops, the Three Sisters, and are try as much as they can to be self-sufficient in agriculture. So you have the sheep, and it's just this way of trying to make sure, and but all these foods are important not only because of human capital, how it helps keep you healthy, but cultural capital, how it tells us who we are. The ways of knowing and being. And this is very important. Again, how do we know? And the definition of what can be changed. And for many people in industrial agriculture, you do what you do because nothing can be changed, because after all, what does the government pay you to produce? Next.
Knesha mentioned sexual harassment. One of the projects that we've been working on is one where we interviewed 75 farm workers in Sioux County, Iowa. And among many other things, we asked them about the kinds of training that they had experienced. And we included a question about the opportunities for dealing with sexual harassment in the workplace. And we found that it was very rarely used as, very rarely was there training on sexual harassment. And most of the workers, both male and female, about 30% of the workers were women, simply didn't know if there were any rules or how they would go about how they would go about lodging a sexual harassment complaint. So I think that's an important part of cultural capital that maybe has more of a class base than a ethnicity base. Then we another thing that we did was, what happened here? Human capital is things like education and skills, but it's also important to think about human capital in terms of health and also self-esteem and self-efficacy. And I recently did some work on examining meatpacking workers and COVID in Iowa, and our record on that is pretty abysmal. But basically, in the early stages of the pandemic, Latinos, who are the majority in most of the meatpacking plants in Iowa, even though they're 6.2% of the total population, experienced up to 27% of the cases of COVID-19. And so we had a very peculiar way of dealing with COVID-19 in meatpacking plants. In nursing homes, if you had a 3 people, either residents or workers, who contracted COVID-19. It was called an outbreak, but the Iowa Department of Public Health set it at 10% of the workforce with respect to meatpacking. And so this is the most egregious case, but in almost all of the cases of packing plants in Iowa, you had much more than that 10% before it was even discovered, because the employers felt that this was proprietary information, and our governor was not at all proactive in trying to pressure them to let us know what was going on within the meatpacking plants. In the case of Perry, which is a Tyson pork plant, 58% of the workforce had COVID-19 before it was declared an outbreak. I'm having trouble with my cursor.
Well, let me go ahead because we're running out of time. We're going to talk about social capital. I'm muted? No. Can you hear me? It's better?
Yes, we hear you.
Okay, good. And I think one of the things that really came out in all the presentations was how working together made a difference, which also then influenced cultural capital. There was big interaction between them. It's mutual trust. Who do you trust? And this was something that was mentioned in terms of health information. Who do you trust to give it to you? Do you trust that outside doctor who you think might be colluding with pharmaceutical companies? Or do you trust your medicine person who has worked traditionally with all your family? It's reciprocity, which means you'll do something for someone in the community because you know that person does something for somebody else. It's not, I'll scratch your back and you'll scratch mine. It's groups, a sense of collective identity. We are farmers. We are Latinos. We are of this tribe. This is all an important part of collective identity that gives you a sense of a shared future and working together. And we've seen how social capital is terribly important and how it then impacts health. And if cultural capital and social capital come together to say, well, if you're sick, you just keep going, you have real issues. Next, Jen.
Jan, sorry to interrupt. Your mic is off.
Returning to the farm worker study in Sioux County, one of the things that we found was that farm workers worked so many hours. 2/3 of them worked 10 to 12 hours a day, and the mean number of days per week was 6.5 days. So it made it very difficult for them to have an opportunity for engaging in social activities. And so we asked them if they belonged to a local group or association, church, etc. And as you see here, about 40% of them didn't belong to any group, and an additional 40% belonged to only one group, which was usually their church. Okay, political capital involves organization, connections, having a voice, and gaining power. And I thought that Cap's discussion of the farmer dilemma was very important, and the lack of child protection policies which resulted from that paradox. And we found among farm workers in Sioux County, very few of them were involved in any organization that dealt with local political questions. So they were pretty disenfranchised.
One of the things that was brought out by the speakers was the necessity when rules and regulations are met, because political capital is the ability of a group to turn its norms and values into rules and regulations that are then enforced. And when you have the people who make those rules and regulations, the people who benefit from poor health conditions of their workers, you have a real problem. And as was pointed out, unless you also have farm workers as well as farmers involved in talking about discussing what the norms and values are that go into the rules and regulations and are organized enough to make sure they're enforced, it makes a huge difference. So we have some very interesting rules and regulations that simply aren't enforced. And it's mainly because people without power really have very little voice. Yeah, this is our favorite form of capital for many people, and we tend to put everything in terms of financial capital. And I was very impressed that our speakers did not mention that, but we see that where it is important is in terms of the provision of health. Rural hospitals are closing at a very rapid rate. We're also seeing the decline of rural local pharmacies. Instead, you have a chain coming in. And the thing about the local pharmacy is you have somebody who's embedded in the community and knows their people. So if they see someone's prescriptions don't seem to match, they can call up the doctor and say, can you make sense out of this? So it's a chant, they sort of help people in terms of health counseling. But these also are disappearing. Part of it in terms of political capital, in terms of the rules and regulations that favor centralization of healthcare, which then leaves out smaller venues, and particularly those for farmers. So the access to healthcare, especially mental health care, is really impacted by financial capital in terms of willingness to pay. And this is a place where public funding can be very important to help make healthcare available. Dan. Okay, build capital, which is part of the hospitals and the pharmacies, but is really much, the pharmacies are really the people, the human capital, and the social capital that the local hospitals have with the community is really important. The build capital could enhance natural capital or detract from it. It enhances it when it serves multiple users, can be locally maintained and improved, links local people together equitably, and links local people, institutions, and businesses to the outside. And one of the issues we see in terms of rural health is that build capital, such as high-speed internet and other things, are not available, particularly if you're a farm worker. One of the interesting pieces of this is how it relates back to social capital. We're seeing the rapid decline of emergency medical teams. So if you're spouse falls over and you can't revive them, and it takes an ambulance 2 hours to get there, you have a problem. Whereas when they're local emergency medical teams, often with volunteers, there's a much better chance that that person would be saved. And we see huge differences in the mortality rates and the life expectations between rural and urban areas. And a lot of that relates to the unsafe conditions in terms of things like water quality and lack of medical attention, and the high use of pesticides that impact local people, particularly farmers.
I just wanted to conclude by saying that the presentations were all just wonderful. And I'm hoping that the community capitals framework is an approach which allows us to take into account the multifarious sides of humanity, and particularly when we're looking at it in terms of agricultural safety. Thanks very much.
Well, thank you both for the comments and for the reflection on the presentations this morning. I think the Community Capitals offers a nice framework for thinking about how we do our work and thinking about the impact of our work beyond just the health and safety outcomes that we may see reflected in government statistics. I feel like we've spent a lot of time this morning talking about some of those groups that are often underrepresented in the research that's done, and often underrepresented and underserved in the outreach and education efforts that we are all engaged in. And so now what I'd like to do is offer an opportunity for the panelists this morning to ask any questions of each other. And then I will open it up for questions from the audience. I have been keeping track of them. If you put them in the Q&A or in the chat, I've got them. So I will be posing those to the panel as well. So panelists, did you have any questions for each other?
Was it still morning? Good morning. I would say just kudos to all the panelists for their insight and their information. It was really good to have a very intentional conversation about vulnerable populations. I love that. That's how this conference kicked off. I would say I put it in the chat because I didn't want to forget. So I had a comment which I made to Seth, Dr. Holmes personally, but I just kudos to the work that you did in the coalition building. I think we can all kind of learn from that model with the work that you did at a very critical time. While, the states were shut down, agriculture was at work. And the most vulnerable were at work. So just kudos to the work that you did to make sure that they had access to testing and things like that. I just want to say a huge thumbs up. And then I had a question for Mr. Bear around just some of the safety concerns around indigenous populations in agriculture, because we don't see a lot about that. If you had any insight around maybe topics or issues that you're seeing within Native communities.
Oops. One thing I hear about a lot is you cannot see me. What a lot of what I do hear about is talking about going to traditional foods and more of the indigenous foods. Yet I do know that a lot of times I think people forget where foods come from, and that if they say traditionally we ate this, yet they don't realize that those foods didn't originate in our areas. or even on this continent, then of course they're not really traditional. And one thing that's like comes about is like cucumbers. Cucumbers come from China or Asia, and I think watermelons actually came from Africa. And so we look at a lot of different food areas that where foods come from, making sure that they are actually traditional, because in a lot of different areas, they talk about different foods and people not being accustomed to certain foods because our ancestors had not been accustomed to those foods, so they affect us differently. So like even looking at sugars, like in different fruits, I mean, they have fructose. Of course, that's a sugar. So, and like potatoes, of course, they're different than they used to be, but even carrots, they're things like that. They have a lot of like carbohydrates and things like that that are not always as healthy as it should be or would be if they were eating more of a traditional food.
And I maybe offer a comment, and Sean, I love, this is one of my first questions I had, and as well in the sense that we actually did a project at the National Children's Center. I think this highlights one of my points about children in these groups. And we worked with the Anishinaabe in northern Wisconsin and the UP, and they wanted to do a traditional act of manoomin, so gathering wild rice by canoe. But they wanted to do it safely, and they wanted to teach their youth how to do it safely. Well, we didn't have an ag work guideline for manoomin. That's a little niche for what we've been working with. And so what we did is we did a pilot grant, and I was lucky enough I got to do be a part of it. And what we did is we asked them to basically take the instructors and go do a canoe safety course. And the first thing you do in a canoe is you don't stand up. Well, that's how they maneuver. And so we had this really interesting conversation about how do you do something that runs up against traditional and constructed safety knowledge in canoe regulations, canoe safety, but in a way that you bring youth into the fold so they can gather wild rice. Now, that's not without controversy because you're working against injury prevention knowledge and kind of known structures, but you're also trying to embrace traditional ecological knowledge. And so that was a really interesting project. And it was one where we tried, and one of the best quotes came from one of the elders and said, you don't have to think about safety. You have to think about respect. If you respect rice, if you respect water, you will do things safely by the natural part of that. If you take your time and think, and it's a meta thinking, right? Thinking about what you're doing while you're doing it. But that idea of craftsmanship versus production built some safety actually into it, but it didn't call it that. So Sean, I'd like you to comment on that. And Knesha, I hope that maybe that's something to your point in your question.
Great point. Thank you.
Yeah, a lot of times when we think about things that others might be considered dangerous, something like that, like as water, like if you're going into a river or lake or anything like that, you respect the water, and they believe that there's spirits within the water. So as long as you're treating it respectfully and things like that, then of course they're going to take care of you. And of course for the wild rice as well, is to be respectful of that and realize it's kind of that it's a living thing and that you're respecting that, and they'll take care of you. So a lot of times that's what we were taught as growing up and things like that. It's like respect what you eat, being mindful of cooking and how you handle your foods, because no matter if you're angry, that anger is going into that. If you're happy, that is going into that. So it's very important of who is handling your food and things like that. Hope that helps.
Thank you, Sean. Go ahead, Dr. Holmes.
Sorry. Thank you all for your comments on this so far. I wanted to share a thought and a couple of resources and ask a question. So if it's okay with you, I'm going to try to do this again. Is that the correct version? Okay.
Yes.
Oh, I meant to show this one. So some of the people in this conference are, including Athena Ramos, are writing a lot and thinking a lot about what's going on in the Midwest. And I don't know the Midwest as well. I know the two coasts related to migrant farm workers. I also know that in my research, both on the West Coast and in the Southeast, the most common thing I've heard from people when I've asked even health department people, something about, I'm here to do a project collaborative with migrant farm workers, they often tell me, oh, they're not here. They're over on the other side of the state, or they're over there. But as a matter of fact, there are farm workers in many, everywhere that there's agriculture. Certainly certain kinds of agriculture have more farm workers than others, but I thought the title of this article, Invisible No More, reminded me of that. And I put together just a few ideas with help from other panelists about ways you all can learn more about migrant farm workers in the Midwest, organizations that are there and organizations that are national related to farm workers, and farm workers bringing their own knowledge and experiences to the table. And then I do really want to encourage you, people involved in agricultural health and safety, to explore and pursue the framework of structural competency. It's taking off in many different parts of the health professions as a way to be aware of many of the things that each of these speakers have talked about: health equities, what goes into community capital, how we can be aware of it in the health system, and how we can respond. So I'll send these to the organizers, and I'm happy to put them in chat. And I, related to the title of your article, Athena Ramos, I wonder if you wanted to say anything about invisibility of farm workers in the Midwest and why that's important to counteract, maybe.
Yeah, that's a great question. And it's something that I think we've been facing here with our work over the past decade. In getting started in this field, I went and visited lots of different communities across the Midwest region, and I'd go kind of through our normal process, right? I'm trained in community engaged research and community-based participatory types of research. And so we go to community organizations who are locally, physically located within the communities that we want to serve. We ask questions of them and try to understand what are the services that you provide, who are the populations that you serve, and kind of get a good grasp for what that community is like. And as I did this and getting started in the work, I often heard that answer, just as Dr. Holmes mentioned: there's no migrant farm workers here. There's no farm workers here, because they are invisible. They do a lot of this work, and there's a lot of reasons for the invisibility, right? A lot of these folks are facing challenges with immigration. There's a lot of fear related to being potentially held and deported, the loss of income to the family and the support that goes along with that. So people are afraid to kind of come out and be able to share more of their stories and engage in what we would say in traditional civic life and community life. Now, I'd counter that. Later, I'll do that because I think people are participating, and we're just not finding the right ways to ask how people are participating and how they're contributing to community life. But the answer that I heard across the board, like resounding, was these we don't have these folks in our community. And we've gone on now to do over a decade's worth of research that looks at migrant farm workers, immigrant farm workers here in the Midwest. And sure enough, we've been able to find these folks. And it takes a lot of, sorry for that, it takes a lot of legwork and groundwork to be able to establish the networks where we're able to find people and have people be able to trust us and establish those collaborations that are not just beneficial to us as a research team, but beneficial to the community at large as well. I mean, that is kind of like the crux of doing this work, is that you want what you're doing to be relevant, to be meaningful for the population that you wish to serve. And so I think it is important that we don't just take that answer of no, they're not here at face value. We need to dig a little bit deeper and really explore that, because folks like these farm workers, these vulnerable groups that we're talking about are all throughout the Midwest. And we need to be aware of that. And I think within our health and safety programming, outreach, our education, our research, we need to do a better job of being able to share these stories and share these narratives of folks. And so going back to my point about being engaged in civic life, we've been doing some studies now in a couple of different rural communities where we're asking people, tell us, so we found these folks, tell us about how, what are the things that you're doing? And we found that people are contributing to their communities. They're donating of their time, they're volunteering for different community organizations, they're giving financial resources, even the little financial resources that they may have. They're talking about community issues. So there's a lot of different ways that people are contributing. And I'd actually like to go back to some of the points that the Floras were making about the different capitals and some of the examples that they shared about how they asked farm workers about how they were engaging in communities. We've done the same. Actually, we did a study in South Dakota and we asked dairy workers, how are you engaging in community life? And even though they're working 6-7 days a week, 12 to 14 hours a day, they're still finding time to go to church, to talk about community issues. Maybe they're not showing up to a city council meeting, but there's other ways that people are participating. And I think that kind of goes to the essence of what this panel was about, is to offer, some other ways of knowing and to value those other ways of knowing and those other ways of being. And so I thank you for the question, Dr. Holmes. I hope I answered it in a roundabout way, that we need to do a better job of looking for those folks and making them visible. Are there other questions, comments, or things that the panel would like to discuss before we open it up to participants?
I just wanted to contrast Seth's discussion of the Immokalee workers and that community in contrast with the one that we looked at, which is Sioux County, Iowa. And it seemed the fact that people were organized in Immokalee meant that they were able to deal with and respond to COVID, I think, much more effectively than we found in our community. And so social capital really is a key element in building community and community organizing. And I also wanted to say to Athena that probably we did miss some of the things that folks were doing, particularly if it was more informal, because we were looking at their involvement in formal organizations. And so we need to go back and do some more work.
There's always more to do. I've got a couple of questions that I want to toss out there. First, to Dr. Bendixsen. Can you talk to us about how does the farm kid paradox apply to ag experiences beyond just beef and dairy, if at all?
Yeah, I think it's a good question, because I think the farm kid paradox idea is limited, right? It's this idea that somehow we have control over vulnerable populations' amount of risk and benefits in a given environment. And so there's definitely limitations to it. And we started with cattle because we knew that, one, there's a lot of cultural capital actually with being involved with cows. Cows are king, as they say in Texas and Colorado and Idaho. And so the cultural capital of beef culture is important, but it also has this kind of immunological science behind it, right? This idea that exposure to cows is good. So we started there, and primarily because it was an idea to resolve injuries, right? And which is different than fatalities, right? We do see fatalities with large livestock, but it's a lot more injuries as result of crushing and kicking. I think the paradox could apply to other aspects of work, such as food production in terms of row crops and things like that. However, the benefits at that point are all kind of in that social cultural capital or social cultural category of benefits, right? That they learn about biology and botany and things like that. And then the hazards are different. So in large livestock, it's kicks and crushes and things like that, whereas in sun exposure with crops and pesticides. And so the calculus just changes a lot. And this is something, once you've seen one farm, you've seen one farm. Every farm's got its own hazards and benefits, I think, which is complicated. But hopefully by approaching cows and kids, we can start to build a model of investigation. And that investigation might prove that all of the benefits perceived by a tractor ride can be supplemented by something else. Tractors are the number one killer of kids. It's constructed as family time and things like that. We know that we can replace that. And so then we become very selective over the traditions, if we want to kind of label it something, that actually have a benefit and a reduced amount of risk. So we're hoping that the model can lead us in that direction, but we have to be open to the idea that it finds something that can't be balanced.
I wanted to tell about a visit I made to a dairy farm in Idaho, where a woman told me that her whole life changed when she met her first Mexican as a dairy worker, because she'd been hiring sort of kids who dropped out of high school, and they didn't like cows. They didn't understand cows, so they would hit them, and milk production wasn't good. When the Mexican workers came, they liked the cows. They got along with them, and everything went so much more smoothly. And that's this intersection of cultural capital with then what you do. And if you come into animals late, large animals in particular, you may have no idea on how to act around them.
It's a great point. And our parents, when we asked this quandary about who's your safety professional, right, to this family farm, and they don't know any safety professionals. I mean, hopefully they would, but they don't. That's not a common phrase. That's a person they have a hard time coming up with. But when they think about materials and knowledge with cows, it's safe animal handling practices. And safe animal handling actually comes from getting cows calm and fat and happy. And but actually the repercussions are usually the workers are safer too. And so for kids, that the idea of like safe animal handling, learning flight zones is really common for kids around large livestock and kick zones and things like that.
Thank you, Dr. Bendixsen. Question for Dr. Holmes. You had the slide just a minute ago about structural competency. Can you talk a little bit more about that, and how do we build structural competency? Like, what would that look like for the ag health and safety field?
Good question. So structural competency, the first time it was written about was by Jonathan Metzl in a book in 2009, where he was thinking about health inequities, health disparities, and how oftentimes we understand what we need to respond to those health inequities to be only cultural competency. And part of cultural competency, a more traditional part of cultural competency, has been critiqued a lot as memorizing kind of traits about different groups. But then more recent version of cultural competency that many people call cultural humility has been more about not being ethnocentric, not making assumptions, getting to know your patients. And the idea of structural competency is that's while cultural humility is super important, not to be ethnocentric, not to assume everyone's the same, it's also important to take on the political, economic, and social structures, to understand them, to understand how they're affecting patients and communities. And when we're thinking about policies or projects or programs, to work with different communities to keep those inequities, those structures in mind. And so Helena Hansen, who's an anthropologist, physician at UCLA, and then this working group have worked on developing different trainings and publishing different articles. We haven't done one, I don't know of one specifically related to agricultural safety and health, which I would love to be a part of. That would be super interesting. But there have been articles, from medicine to nursing to social work to women's health to public health, thinking about to global health, thinking about how does this awareness of these really upstream structures and how they affect patients and communities lead us to act differently. So in the chat, I put some links from the slide. And the first one and the second one, you can find examples of PowerPoint slides, a training manual on how we as the Structural Competency Working Group have thought about what structural competency is. And you can take any of those and use them in your own context or change them a little bit. We've developed this way of thinking about health that we call an arrow diagram, where we take an individual or a community's kind of health experience, and then think about the places where political, economic, social structures that are unequal impinge on those people, and where their own assets and resources and knowledge can be harnessed to counteract it. So I think it's a great question. I would be super excited for structural competency to move into this area more, and I'd be interested to keep talking about that, because I think some, Journal of Agro-Medicine and other places could be great to get this framework more into this area specifically. Thanks for the question.
You're welcome. I think that's a great idea. I know we've had some conversations back and forth just as you're talking about how we need to have more of this in the ag health and safety world. So I'm sure we'll be following up with you for more on that. We did have a question from participants and to the panel. If we could talk more about farm workers and farmer solidarity and how those can be used to tackle injustices. So I'd open that up to any one of the panelists.
I know of a few organizations. There's one up in Washington State called Community to Community that was working to have discussions where farmers and farm workers would be sitting together with interpreters talking about what they're concerned about and what their priorities are, so that in some ways to counteract some of the power inequalities that the Floras were talking about related to capitals, to get people to really listen to each other and talk with each other as human beings. And I can remember examples of when coalitions of growers and farm workers were pushing for the same policy, protection of farm workers, for example, that they could do their work without, the farm workers don't want to be worried about being raided or having some kind of disruption, and neither the growers don't want that either. They want to be able to count on the laborers that they need. But I can think of examples where there's been specific solidarity. And I can think of lots of examples where there hasn't been. So if other people have examples or ideas, I think that's important too.
Absolutely. To follow, I was going to say the same thing. Washington State has some great resources and models to look at. With my sexual harassment prevention training, Pacific Northwest AgriSafe and Health Center had a wonderful coalition of, I believe OSHA was involved, employer organizations were involved, in migrant farm worker groups, where they kind of did surveys and talked and really figured out what would be a great outreach toolkit to kind of just bring awareness that this, even though this is an inherent issue, it's not common, and what are some safety training that's available in language that migrant farm workers would receive and understand. But I loved how across the spectrum, it brought everyone to the table that had a stake, because if you have, farm workers that are concerned about their safety, it impacts, well, first of all, it's a health, it's a human, right issue to be able to work in a safe environment. But two, it reduces your productivity, across the spectrum. So everyone kind of came from it from their own vantage point at how could this improve overall worker conditions, overall outputs from farm workers and things like that. But it was a great example, and it's called, I'll put the link in the chat, the BASTA Preventing Sexual Harassment in Agricultural Toolkit, and they continue to build on it. But it was amazing to kind of see that work and how they really took a grassroots approach to bring everyone to the table. And that's what we say in that training. It's not just the responsibility of that person to report, but if you're not a female and you're seeing this, it's your responsibility to speak up and bring those concerns to the table, and everyone has a stake in it.
Well, thanks for sharing those two examples. We have one final question, and I know we have like 1 minute left. So, Sean, perhaps you can talk about maybe the popular ag training and degree programs that might exist at tribal colleges here in the Midwest.
I think a lot of times what will happen is they're going to regular colleges. I haven't seen any going to just regular farming. I know that a lot of times the people, at least on our tribe, are hiring people from like Iowa State and things like that for their program. People have been going to school there for quite a while. A lot of times we also use outside programming for them to come in and help. The biggest thing is for those people from outside the tribe is to learn the cultural practices of how we handle certain things.
And Little Priest Tribal College is trying to integrate that into their agricultural curriculum. So this conference will be very useful to them. So thank you all for the link.
Yeah, I don't believe there's any tribal colleges in Iowa. So.
Thank you. Did you have any, this is the follow-up question from the participant. Did you have any recommendations for how we could better collaborate with tribal colleges?
Whenever you're dealing with anything that has to do with tribal, a lot of times it's not just what you want from them. You have to be able to give back, in a sense. That's one of the best things to do, to work with tribes.
Perfect. Well, on that note, oh, I'm sorry. Cornelia, was that you?
Just one thing that I was going to build on what Sean said, which is that it also means just going to the tribal college to learn. I think that's the first thing we do, is just go and learn what they're doing, because you'll learn a lot and then can figure out how you can work together. And the notion that we transfer knowledge is a mistaken notion in development, and certainly mistaken notion when you work with Indigenous people. You can mutually create new knowledge, but you don't transfer, step by step, because it won't work.
So in the interest of time, we have come to 11:15 quite quickly this morning. I do want to thank all of the panelists for taking time out of your morning to be with us here at MRASH. Thank you for sharing your expertise, your experiences, and for highlighting some of the vulnerable populations, quote unquote, vulnerable populations that you work with. We appreciate that. And we hope that this is really the beginning of a conversation about these populations and how we can do more and do better in the ag health and safety world. I do want to thank all of our participants for joining us this morning. I believe, Brandy, correct me if I'm wrong, but but I believe we have a 15-minute break before we go to the next session, where there is Knesha is going to talk a little bit more about women, if I'm not mistaken, and you can hear some lightning talks as well. Again, thank you all for the opportunity for me to be with you and to be together this morning. Hopefully you're walking out of this this virtual room with some new knowledge and some new perspectives. Have a great day, and we'll see you at the rest of the event.
Yes, so we will reconvene on regular Zoom. I'm just trying to drop this link in the chat right now. For our next set of talks, we will reconvene at 11:30, so that Central Time. So that gives us 11 minutes, an 11-minute break before we continue our discussion on the other platform, and we'll all be together in the Hollywood Squares format for Knesha's talk and others. So thanks to our panel. This has really been a lovely morning and a fabulous way to kick off our conference. I'm so grateful to you all.
Thank you.
See you shortly.